My name is Brooke Hudspeth, and I am a pharmacist and a certified diabetes educator with Kroger Pharmacy, as well as an adjunct assistant professor at the University of Kentucky College of Pharmacy. I know oftentimes when people think of a pharmacist, they think of someone who is kind of in a box, filling prescriptions, getting pills sent out the door, but there really is a lot more to pharmacy than that. Pharmacists have a lot of different opportunities. A pharmacist in the community is responsible for ensuring the appropriate medications used for patients. What I do is even a little bit more different in that I specifically work with patients that have diabetes and who are at risk for diabetes. So I was born and raised in Elizabethtown, Kentucky, and came up through Hardin County school system, started in GC Burkhead in elementary school, then went on to East Hardin Middle School, and finally on to Central Hardin High School, where I graduated. From there, I went on to the University of Kentucky College of Pharmacy to complete my undergraduate studies. And then after 2 years at UK in undergrad, I went on to pharmacy school, also at the University of Kentucky at the College of Pharmacy there. Upon graduation, I then did an additional year of training. I did a postgraduate year 1 residency with an emphasis in community pharmacy. The University of Kentucky is one of the top colleges of pharmacy in the nation, and it's a really competitive process to be able to get into that particular College of Pharmacy. And really, a lot of professional schools, it's a little bit more competitive and a little bit more difficult. So you have to have good grades, so that's one of the components they look at for entrance. So having a strong academic background, having a high GPA is very important. Also, they look at the entrance exam scores. So the PCAT is the particular test that's required to get into pharmacy school. And so those scores are also evaluated and used to to determine who to enter into pharmacy school. And then finally, there's also typically a written application. And if you pass those 3 components, then you get accepted for an interview or invited for an interview. And then after that interview process, it's also pretty intense. It's usually a day-long interview process. Then it will be determined if you're accepted into the college. Well, I feel like, there are a lot of lessons, a lot of resources and tools that were afforded to me through my education, specifically at Hardin County schools. And so I feel like, the lessons that I was given as far as, determination, hard work, wanting to succeed and do well, and that were taught to me by several teachers throughout my years in Hardin County schools, also through coaches, to strive for perfection, to strive to be the best that you can be. Those are all lessons that have been very valuable moving forward. Additionally, outside of the education piece, just some good lessons about values, what's important, to care for others, have compassion for others, and those are all things that were instilled in me at a very early age and throughout the years, and especially throughout my time in the Hardin County school system. A subject in high school that I didn't really realize would be so important was actually our keyboarding class, or learning how to type. That was probably one of the most valuable classes that I had in high school. Didn't know it at the time how much I would truly use that in my profession and throughout my college years. So that was something that was very valuable. But aside from that, some of those core classes, like some of the business classes actually were very impactful, as were a lot of those chemistry and math classes, and having to solve problems, use logic. And those are all skills and things that I learned that have really been useful in my life and in my career. Pharmacy is a profession where you are compensated usually very well. Pharmacists, that's, one of the things that you work hard and you have a big impact, and, what you do can really impact a patient's life. So, oftentimes you're compensated as such. I would say it's of the healthcare professionals. It's one of the higher compensated fields that you can go in. For the most part, usually you can find a position where there are pretty good benefits as well too, which are really important. So in order to succeed in a career like mine, I think there are a lot of qualities that would be necessary, but if I had to say that one really stands out, I would just say that it would be hard work, kind of synonymous with dedication. And so being able to work hard and to really make sure that you are focusing, I think, is very important.